Good afternoon, members and guests. It is Tuesday, March the 5th, 2024, and I hereby call the Population Health Committee to order. And before we get started, I want to see if there's any personal orders. You are recognized, Representative Clemens.
Thank you, Madam Chair. I appreciate it. I'm sure this has been done already today, but as we have seen walking the halls, we've seen a lot of white coats. I've had ophthalmologists or eye surgeons, and we've had a lot of other doctors. So I just want to welcome all the healthcare providers to Capitol Hill today.
Thank you so much. And I was just looking out, trying to scan the crowd to see if I see any from Knoxville. So I had several in my office a little while ago. And but anyway, I also want to recognize and welcome you all for Doctor's Day on the Hill. And please come and join us anytime. Chairman Farmer.
Yeah, thank you, Madam Chair. And I see in the back there, I have a constituent here, Kelly O'Connor. I don't know if her husband Will and her two children are still here, but I really appreciated you all coming to see me today, and just thanks for being here.
I do have a couple announcements to make. That's right. Yeah, we'll go ahead and do that. So we'll go ahead and call the roll.
Clemens, Farmer, Helton Haynes, Hemmer, Kumar, Rudder, Terry, Travis. Madam Chairman, you have a quorum.
Okay. Thank you. It has been brought to my attention that we have several standing, and unless you are a member getting ready to present a bill, everyone must take a seat. So if there are any seats available, if not, you're more than welcome to watch it outside on the TV. Okay, so let's go ahead and move on if there's no other personal orders that anybody has. So we'll start with our first bill is House Bill 2462 by Helton Haynes, and it is taken off notice. So without objection, it's taken off notice. Our second bill is House Bill 1627, and Representative Bain has asked that it be rolled to the Hill. Without objection. 1626, yes, House Bill 1626. That will be heard at the end of the agenda. Okay, so yeah. So now we are going to take up, I'll get to it, item number 4, which is House Bill 2227 by Representative Love. And this is going out of order, but he's got another place to be. Okay. So House Bill 2227, do you have an amendment?
Madam Chair, we did have one, but we are not going to attach that amendment to this bill.
Okay. So, you are ready to proceed.
Thank you, Madam Chair. I think we do have some people who had testified, and I didn't know if the committee wanted me to present first or have the testimony first.
I mean, I would prefer that you just go ahead and discuss your bill, and then Representative Clemens.
Madam Chair, I would like to request a roll call on this vote, if you don't mind.
Okay. You want to explain your bill?
Thank you, Madam Chair. House Bill 2227 simply adds clarifying language to state that abortion does not include the use of contraceptives, including a device, medical, biological product, or procedure that is intended for the use in the prevention of pregnancy, whether specifically intended to prevent pregnancy or for other health needs, or the disposal of embryos resulting from fertility treatments, including healthcare services, procedures, testing, medications, treatments, or products. And so we just want to clarify that, again, abortion does not include use of contraceptives or things like IVF. We know that we have situations where when we pass bills sometimes, There's not clarification around what it does or does not do. And this bill was brought to bring that clarification so that persons will be specifically understanding what is not included and what is included in these definitions.
Do we have any members that want to ask any questions before we go out of session and hear those who have asked to testify? No? Okay. So we're ready. We will go out of session and call up the first one. And where's our list? So we have, and you actually, there's 3 of you. So if you want to all 3 come up at the same time, and when we call on you, if you'll just state who you are, there's Kelly Nowers, Courtney Jocelyn, and Harper Grace Niedermeyer. So are we missing one? Okay. So, okay, do you want to state, and whichever one wants to go first? You have 2 minutes, and so state who you are and who you're with.
Hello. Okay. Thank you, Chair Lady and committee members. My name is Kelly Nowers. I'm here in support of HB 2227, and I'm speaking today in my role as a mom to a 17-month-old son who is here today, eating some grapes behind me, and mom to a little girl that is due in September, and I'm proud to say both of them are IVF babies. After close to a year of trying to grow our family, my husband and I sat in our doctor's office as she told us the only way we'd be able to have children was through assisted reproductive care, specifically in vitro fertilization or IVF. I spent the next 6 months undergoing multiple procedures and following strict medical regimens to prepare my body for egg retrieval and embryo transfer. All of this prior to the incredibly difficult and risky experience of simply being pregnant for 9 months in one of the worst states for maternal health outcomes. Approximately 1 in 6 couples are affected by infertility in the United States, which means my husband and I join about 6.7 million people each year who have trouble conceiving. We were privileged to have the accessibility and opportunity to benefit from IVF, which unfortunately cannot be said by everyone who experiences this. I'm here today because I fear that misinformation conflating the definition of abortion threatens access to birth control and fertility care, both of which remain legal in Tennessee. When legislatures and courts like the one in Alabama makes decisions and rulings that inadvertently impact access to fertility treatment, it spreads panic among Tennesseans who are relying on this needed care to build their families, and panic among the physicians that are providing that care. The bill before you is simple and straightforward by documenting in law that fertility care and contraceptives are different and separate medical treatments and are legal for Tennesseans, aligning Tennessee with every leading legal and medical organization. I urge you to vote yes on this bill to protect the access that so many Tennesseans, including myself and my family, rely on to make important decisions about building their family. Thank you.
Thank you. Okay, the next one, just state your name, who you're with, make sure your red light is on. You have 2 minutes.
Thank you, Chair Carringer and members of the committee. My name is Courtney Jocelyn. I am a resident fellow at the R Street Institute. R Street is a right-of-center nonprofit public policy research organization whose mission is to conduct policy research that promotes free markets and limited effective government. For 6 years, my team has studied state and federal contraceptive policy with an eye toward reducing governmental red tape in healthcare. I was also born and raised in House District 17, and I'm here to encourage passage of House Bill 2227. This bill is very simple. It would clarify that using contraception or undergoing IVF does not violate the state's abortion ban. You may hear from some that this shouldn't need clarification, but I can assure you that it does. In theory, any law or regulation that is unclear to citizens is subject to court action. And in practice, this appears to be the case here in Tennessee. In August 2022, a couple of months after the Dobbs v. Jackson decision, which was solely related to abortion, WPLN here in Nashville ran a story titled "Navigating Birth Control in Tennessee's Post-Roe World." In that story, local doctors were quoted saying they had been inundated with questions and concern over birth control accessibility. In December that same year, the Pulse in Chattanooga highlighted a survey showing that 3 out of 5 young adults believed birth control would be harder to access after the Dobbs decision. So after Dobbs, the medical community saw consumers stockpiling contraception, and constituents across Tennessee were no exception to this. This concern extends nationwide. So in turn, many of your neighbors have passed laws that explicitly carve contraception out of abortion restrictions. This includes Georgia, Kentucky, Arkansas, South Carolina, among others like Arizona and Oklahoma. They've all enacted contraceptive carve-outs to clarify that there is no restriction on the sale and use of contraceptives. Tennessee has yet to do so. This marked increase in worries over birth control aligns with data we've seen nationally.
You're out of time.
Okay.
Thank you so much. Okay, well, do any members have any questions for our witnesses? Representative Himmer?
Thank you, Madam Chair. What type of role do you see this legislation protecting IVF and fertility care?
So I think this is merely clarifying for those undergoing current IVF care that they wouldn't be subject to any criminal abortion consequences.
Okay, Representative Himmer?
Just curious with the Alabama ruling that came down last week, what type of questions have you been getting asked, and what type of advice do you have for us here as legislators in Tennessee to make sure that doesn't happen here?
Absolutely. So I think the number one question we've gotten is, what does this mean for us? We've gotten this from a number of state legislatures as well to ask, what does this mean for us? Do we need to pass protections for IVF? So a number of states are currently entertaining the idea of passing clarification for IVF.
Are there any more questions for our guest? Oh, Clements? Okay.
Thank you, Madam Chair. So I guess and you've addressed this somewhat, that any claims that this type of clarifying legislation would be unnecessary in some way. Can you address that concern for anyone?
Sure. So I think if it were unnecessary, we would see fewer concerns over the legality and accessibility. In looking at the language of this bill and comparing it to other states, this is not a Trojan horse bill. It does nothing except clarify that contraception and IVF remain legal and accessible.
Thank you, Madam Chair. So, I mean, given the statutory definition that exists today on this issue that we're seeking to clarify, what exactly will this protect, just for the record?
So this would ensure to Tennesseans that they are still able to access IVF treatment as well as contraception. So all contraceptives that are on the market that are currently legal and accessible here, it just clarifies to them that none of anything related to the abortion ban here in the state relates to their contraceptive care or their IVF care.
Thank you. Thank you, Madam Chair.
You're welcome. Are there any more questions? We've got Dr. Kumar is next.
Thank you, Madam Chair. Thank you, Ms. Nawers. Congratulations. It's very important to have family, and you have gone a long way, and medical science has done you well. And it was a lot of work and effort and heartaches for you. We really admire you. I apologize if this question is personal, but the question would be, did you have excess embryos during your journey, and what did you do with them?
I do feel comfortable answering, yes, we did have extra viable embryos. We made the decision of what to do with those embryos in consultation with our doctor and our family. So, yeah.
Well, thank you. That's all. Thank you, Madam Chair.
Okay, does anybody else? I don't see anybody else on the list. Does anybody else have any questions for our guest? Okay, seeing none, we will go back into session. And so then, sponsor, did you have anything else that you want to add before open it up for questions on any members here.
I just want to add that our colleagues in Alabama are in the process now, I think, of passing clarifying language to also ensure that their constituents down there are clear about what is protected under their new law. So I'll just add that piece to it, Madam Chair.
Representative Clemens.
Thank you, Madam Chair. And I would just say, this is I know this is touching on a sometimes controversial topic if you just hear the topic itself. But as we've heard from the testimony and from the sponsor's description, this is a very simple, straightforward piece of legislation just seeking to protect that access that was described earlier. And it's actually bipartisan. I think Alabama's considering it. We heard all the southern states that have passed this type of legislation. And I was actually even shocked, to be honest with you, rightly or wrongly, that the former President Trump has publicly touted his support of in vitro fertilization, or IVF, and it's called on the Alabama legislature to act quickly and protect this type of care or access across that state. So, I'm excited that this is an opportunity for this state to do what is right in this instance and make sure we clarify this language to protect access. So thank you, sponsor. I know there was reference to an amendment earlier, Madam Chair. And so we did not adopt an amendment. So if anybody's watching at home and they see the description on the website of the legislation, unless legal has an objection, I believe it fairly and accurately describes the legislation before us and the very limited nature and narrow tailoring of this legislation. So I don't want anybody to think that there's some amendment floating out there, some secret language. This is what it is and as it has been described. So thank you, Mr. Sponsor, Mr. Leader, for bringing this legislation to protect access. Thank you.
Chairman Terry, you're recognized.
Thank you, Chairman, for the recognition on this. And the sponsor and I have talked about this bill last week, and I just do want to point out that even though we're talking about this being clarifying language, to me, there's actually more confusing language in this, in that the laws we currently have, and as the testimony we just had, both IVF and contraception is legal in the state of Tennessee. And even after the ruling that came down in Alabama, there's even articles about doctors who have clinics, IVF clinics, getting potentially their patients and potentially the embryos sent to them. And so it is legal here in Tennessee, and there's not something that anybody's doing to not make that legal here in Tennessee. In fact, we do have a AG's opinion that came out that said, no, the Human Life Protection Act only applies when a woman has a living unborn child within her body. And so the AG's opinion says that it is protected. And to that point, that would also apply, the AG's opinion would also apply to contraception, in that it says on their analysis, to perform an abortion within the meaning of the law, a person must use an instrument, medicine, or drug or other substance or device with intent to terminate the pregnancy of a woman known to be pregnant. By its definition, a contraceptive is given to someone that is not known to be pregnant. You're preventing a pregnancy. So it's already protected in here. The other thing that is confusing and not clarifying in what your piece of legislation is as you have defined in vitro fertilization, or the disposal of embryos resulting from fertility treatments, including healthcare services, procedures, testing, medication treatments, or products. What that says is that if you have in vitro fertilization and you do selective abortion, it allows abortion. So as you have this drafted, it does allow abortion. And if we could go out of session to ask legal services for clarification on that, but that's the way I read this.
Thank you, Chairman Terry. And yes, I was just going to ask, so we're going to go out of session to hear from legal.
Michelle Fogarty, Legal Services. The Attorney General opinion that you have referenced states that disposing of an embryo that was created outside of a woman's body and that has never been transferred to a woman's body does not qualify as an abortion. Only when an embryo has been transferred to a woman's body would it be considered to be living within a woman's body. I think what you're referring to is that the language in the bill does not differentiate between embryos that have been implanted versus unimplanted embryos.
Chairman Terry, you want questions
So-
for legal?
Thank you. So then they could do a selective abortion the way that this is written.
The language in the bill before the committee, as I said, just says the disposal of embryos. It does not specify unimplanted embryos.
Madam Chair, if I could respond.
The Clemens want to, yeah. So you're wanting to ask legal or you wanted to ask sponsor? Oh. Okay, you're
And I'll
wanting,
respond when we get back in session.
okay. Yeah, that's what I'm saying. So do you have a question for legal or, okay, then go ahead, you're recognized.
Thank you, Madam Chair. In response to the chairman's question about, or the response about the AG opinion, wouldn't it be correct that a statute would hold more weight in a court of law than an AG opinion?
Attorney General opinions are persuasive. They're not law. They're just persuasive. But it's his interpretation of the law. That's his interpretation of the current abortion statute.
I guess my question is around if we had a court case similar to what happened in Alabama, wouldn't a state statute of if this were to be in law hold more weight with the court than an AG opinion?
That's for the court to decide, but a court would look at case law and statutes, statutory law.
Thank you.
Are there any more questions for legal while we're out of session? Okay, seeing none, we're back in session. And I have Representative Clemens.
Madam Chair, I believe the sponsor wanted to respond
You want to
briefly.
respond for Clemens?
Thank you,
Okay, go
Madam
ahead.
Chair. And I'll say to my colleague, I've been here 12 years. And I have seen many bills come up after we have adjourned sine die the next year to clarify something we did not clarify while we're in session. And I would hope that we would not miss this opportunity while we're here now with this bill to clarify so we don't have to come back next January with a bill to clarify while families wait 6 to 9 to 12 months, all because we missed the opportunity now. Look at what Alabama's doing. They are doing exactly what we're proposing now, but it took them to rush through a process to get to where we're trying to get to right now. So I would simply say I know that there are concerns about what the language says, what the AG says, but I would say to you right now, we have a bill in front of us, very plain, very simple, gets to the point of it, and it clarifies. Matter of fact, I heard a bill on the floor last night to clarify what we did not clarify before. So I would just encourage the members to contemplate that, and I'll yield to my colleague who had a statement to make, I believe.
Representative Clemens?
Thank you, Madam Chair. And I think we've got to be very careful, and the need for clarifying legislation here is imperative to protect this type of access. Because, again, an attorney general's opinion is simply one attorney's opinion, but codifying language makes it very clear that this access is protected. We can see numerous unintended consequences from the way that laws are worded. For instance, in the Alabama case, there were couples who sued for damages for the wrongful death of their embryos after their embryos were accidentally destroyed while in storage at a fertility clinic. That same case would likely turn out differently here in Tennessee based on the different wording of Tennessee's wrongful death statute, which allows recovery for an unborn child at any stage of gestation in utero. The Alabama plaintiffs were couples who had benefited from IVF treatment and had healthy babies as a result of IVF care. The question then should be asked, were they trying to shut down IVF clinics like happened? No, that wasn't the point of the case, but that was how the law with vagueness can be misinterpreted to have that effect. That is not something that we want happening here in Tennessee. And like I said earlier, this is an opportunity. I think we see bipartisan support for this in Alabama now and all these other southern states that are rushing to correct this and protect this vital treatment. I just would hate for us to misinterpret the true intention of the sponsor and the clear and plain language of this bill and go down a route that leaves Tennessee families vulnerable to a misinterpretation by a court. We talk often about how we do not want judicial lawmaking. We are legislators. We have the opportunity to make the law very clear. We're sitting on top of an opportunity right here before us. Don't let a judge or a panel misinterpret our intentions in the state of Tennessee. This legislation is 100% necessary to protect this access. So I would ask, I would beg, I would plead with my colleagues, let's don't go down a path that is unintended here today. Let's stick to the clear and plain language of this bill, the sponsor's good faith intent for this legislation, and let's pass this legislation. Thank you, Madam Chair.
Do we have any more questions? Chairman Kumar, and then, okay.
Thank you, Madam Chair. This may be a question for legal again, just for simple clarity. In current Tennessee law, is it abortion if the embryos created during in vitro fertilization are disposed? Is it abortion? And secondly, in our current law, do we have statute that prohibits in any way the use of contraception?
Okay, we're going to go out of session again and listen to legal.
Michelle Fogarty, Legal Services. Representative Kumar, the statute defines abortion as the use of any instrument, medicine, drug, or any other substance or device with the intent to terminate the pregnancy of a woman known to be pregnant. As I stated, the Attorney General has opined that disposing of an embryo that was created outside of a woman's body and that has never been transferred to a woman's body does not qualify as an abortion. Such an embryo may fit the Act's definition of an unborn child, but the Act does not prohibit the embryo's disposal unless and until it is living within a woman's body. Only then can the embryo's gestation render a woman pregnant. And if there is no pregnancy to terminate, there can be no abortion.
Chairman Kumar.
Thank you. The Attorney General's opinion is clear, but if we go back to the basics fact that under current Tennessee law, disposal of the embryos created during IVF is not abortion. Is that a true statement?
That is how the Attorney General has interpreted the current law.
All right. And the second part, do we have any laws in our books that prohibit or criminalize the use of contraceptive devices?
I don't think there's a statute that specifically states contraceptives are prohibited.
So there is no law against it.
There's no statute that specifically states.
Thank you. Thank you, Madam Chair.
Chairman Terry, you have a question for legal or just
Back
a,
in session.
okay. Okay, we're going back in session and Chairman Terry.
Thank you. And to follow up on that, what our legal services had just said, and again, contraception is legal in the state of Tennessee. Plan B is being handed out at Vanderbilt, and with their litany of attorneys, if it wasn't legal in Tennessee, they would not be handing it out. We have a bipartisan law on the books that we passed last year that protected both, it did not prohibit contraception and protected IVF. Those were discussions that we had before we brought that bill last year. When you put confusing information into law, and our Attorney General says that he can defend the law that we have that does not outlaw abortion, outlaw contraceptives and allows for IVF. He can defend that, and that's the strongest, that it's one of the strongest laws that we have in the nation, and he can defend that. But when you put confusing language in there, it makes it harder to defend, and it puts the unborn at risk. And this amendment, as it is written, will allow for selective abortion during IVF. So with that, I will be voting no on this bill.
Thank you, Chairman Terry. And I want to echo what my colleagues have just said. I've heard Alabama, I've lost count how many times I've heard Alabama. We're living in the state of Tennessee. We do not abide by Alabama's state laws. We're the state of Tennessee. And there is nowhere in our bill that prohibited IVF or contraceptives, just like my colleague has mentioned. So with that, are there any more questions for our sponsor? Travis, you're recognized.
Thank you, Madam Chair. And when I talked to the Representative Love, I signed on to his bill, the contraceptive. I believe in that. I do believe that the women has the right to do that. Now I'm just a little confused on the IDF part of it. That what Chairman Terry was saying. Our intent here is not to allow abortions after that embryo has been brought into the mother and brought alive. Is that correct?
Correct. This is about the process that I would say this conversation right here, I think justifies the need for the bill. I'm being very serious. Because you and I came in together.
We did.
10 years from now, all of us may be gone. The AG may be new. And if this question is not answered, you're going to have some families who may not be sure about what process they can pursue to start their family. And that's why we pass clarifying language. That's why we put things in code so that everybody knows what can and cannot be done, what is and is not the law. And that's why we brought the legislation. It is to make sure that those who want to use contraceptives are clear that it's not abortion, and those who want to pursue IVF are clear that that also is not abortion. And that's why the language is as clear as we could make it, and didn't want to add anything extra in there.
Thank you, sir.
Yes, sir.
Are there any more questions for the sponsor? And are we ready to vote then? I see it. So it's a roll call vote, and clerk, I don't think Clemmer. Did you want something else to ask sponsor? Okay.
Thank you, Madam Chair. There's been a lot of unnecessary debate on this topic, but I think it's important to let's go ahead and put on the legislative record here. Representative Love, Leader
Yes.
Love, is it your intent in the language of this legislation, the use of the word embryos to refer to an embryo that has been implanted or before it is implanted?
Before.
Thank you. Thank you, Madam Chair.
Thank you. Are there any more questions for a sponsor? And seeing none, we ready for a roll call? So clerk, we call the roll.
Clemens,
Aye.
Farmer. No. Himmer,
Aye.
Kumar. No. Rudder. No. Terry. No. Travis. Madam Chairman?
No.
5 noes, 3 ayes.
Okay, the bill fails. So moving on to,
Thank you, Madam
Yeah.
Chair and committee members.
okay, we will be moving on to Gloria, Representative Johnson's bill on number 3, House Bill 1943. Okay. Okay, so, hold on a minute, let me get through my papers here. Yeah. So we are going now to item number 2, House Bill 1626 by Representative Bain. You may go ahead and yeah. We're taking up House Bill 1626. Okay.
Thank
So
you.
you're ready to go. Thank you.
Thank you, Chair Lady Carringer. Well, that was disappointing, but I'm excited to talk about my bill, which our bill, Senator Lyndon Lamar and I, which is the vision for what we believe the state deserves in terms of reproductive justice. This is an important bill that would safeguard Tennesseans' freedom to make their own personal decisions about reproductive health care. All Tennesseans should have the freedom to decide if and when it's right to have a family and the freedom to chart our own future. I envision a world where Tennesseans are free to have and raise their children in safe and supportive and healthy and loving communities free from government interference in their personal and family decisions. But as Tennesseans, we are experiencing the trauma and harm of extreme abortion bans, maternal health and contraceptive care deserts, and a staggering infant and maternal mortality rate, especially for brown and Black Tennesseans. Tennessee law makes abortion care in this state a Class C felony punishable up to 15 years in prison, with only narrow exemptions to allow care in some medical emergencies. I hear a lot in these hallways that we're a free state, and it doesn't feel free. As one of the few child-rearing women in this General Assembly, it feels suffocating to live here. I am proud to put forth this legislation because I fundamentally believe that abortion ban exemptions are not adequate solutions. They don't increase access to care for people who need it the most, and they harm people seeking care by requiring someone to plead their case to a judge, lawyers, and hospital administrators. It's cruel and unfair to expect that this of any Tennessean, and especially survivors of sexual assault or incest, or someone with a medical emergency. People should not need permission to access the care they need. Finally, healthcare access, including abortion, pregnancy care, have been reserved for wealthy white people who can find a way to access the care they need. I stand today bringing this bill so that for the first time, all Tennesseans can access the healthcare they need. And I will keep fighting until all Tennesseans can make those decisions unburdened. And with that, I'd like to ask to go out of session so that Senator Lyndon Lamar can speak.
We will go out of session and bring up Senator Lyndon Lamar and Jennifer Pepper. Both of you can come, and you need to state your name and who you're with, and you will have 2 minutes each.
Senator Lyndon Lamar, Chairwoman of the Senate Democratic Caucus, and also co-sponsor of the Fundamental Right to Reproductive Health. This bill will restore rights to abortion, a right that women have had for the 50 plus years until recently. The fight to reinstate abortion access is about allowing women to choose their own life. It is imperative that we introduce this legislation and ask our committee members today to put aside partisan politics and restore this fundamental healthcare right to all women. According to the CDC, Tennessee has already have one of the highest maternal mortality rates in the country, and Tennessee's extreme abortion ban puts more lives at risk. Mothers living in states like Tennessee that banned abortion after dogs are 3 times more likely to die during pregnancy, childbirth, or soon after giving birth. Babies born in states with abortion bans like Tennessee were 30% more likely to die in their first month of living. And our Tennessee Hospital Association has reported that our rural hospitals are already facing shortages of physicians, OBGYNs, and healthcare professionals, with more than 16 hospitals being closed since 2010 in these rural areas. Now, recent reports have already revealed that what? Tennessee is failing children and families already. We are not doing a good job of taking care of the mothers and babies we have here right now in this state. So Tennessee has now one of the most extreme abortion bans in the country, and we're putting more lives, women lives at risk. So what does that mean? If you're raped, you have to carry your rapist baby. If your uncles decide to take advantage of his 12-year-old niece, his 12-year-old niece has to carry her uncle and rapist baby. If a human trafficking victim is being sold to her pimp and gets pregnant, she has to carry her pimp's baby. And if a 35-year-old woman recently got breast cancer, she has to wait to start her treatments because of the fact that she is pregnant with this abortion ban. And now we are at a shortage of OBGYNs. If we do not pass this bill, women will die or suffer from extreme trauma because the majority in this legislature believe the lives of the living matter
Time is
less
up.
than the lives of the
Time is up.
unborn.
So thank you very much, Senator Lamar. Okay, next one up to speak. State your name and who you're with, and you'll have 2 minutes.
My name is Jennifer Pepper, and I'm the president and CEO of Choices Center for Reproductive Health in Memphis, Tennessee. I'm incredibly honored to do the work that we do. We are one of the only nonprofits in the country that truly respects a woman's right to choose to take care of her pregnancy as she sees fit. Does she want to end her pregnancy and keep her family the size it is? We can support her with that. Does she want to expand her family and grow her family? We own and operate the only birth center in all of Memphis. It's only 2 in the state of Tennessee. Because we envision a world where everybody can have the family they want to have when and how they want to have it. Abortion bans do not stop abortion. And bringing this fundamental right back to the state of Tennessee will support all of our families. We envision a world where Tennessee and Tennesseans have the right to raise their children in safe, supportive, healthy, and loving communities. We envision a world where pregnant people get to choose to either end their pregnancy, carry their pregnancy, or choose to give their pregnancy to a loving family through adoption. Abortion bans often are in states that have disproportionate impacts in maternal and infant mortality. There are other pieces of legislation we could support that would increase the environment and the context that allow people to expand their family. But for now, it is really important that we support this bill and that we bring the right to have as the families we want to have, how and when we want to have them back to Tennessee. Thank you so much.
Thank you very much. Are there any questions for our guest? I see none. Representative Hemmer, you're recognized.
Thank you. Thank you for sharing your stories today. Senator Lamar, I was just wondering, can you please expound upon your answers, and tell me why this legislation is necessary?
Thank you for the opportunity, Representative Hammer. The truth of the matter is abortion bans are not adequate solutions to saving lives. They don't increase access to care. They harm people seeking care by requiring someone to plead their case to a judge, lawyer, or hospital administrator. It's cruel and it's unfair to expect that survivors of sexual assault or incest or someone with a medical emergency has to neglect their trauma or medical issues to have to carry a pregnancy to term. People should not need permission to access the care that they need. This should be the rule, not the exception. It is the fact that women should have complete autonomy. It's also personal. Many of the members sitting on this committee remember my freshman year in the legislature when I almost died because of pregnancy. So I know firsthand how dangerous pregnancy can be, and that if someone were to experience a medical emergency, how necessary it is that they can access this healthcare option such as abortion. But because we taken that away, we are now putting women at risk of dying. The truth of the matter is this legislature and this body has not done right by the children that's already here in this state. DCS is failing. Our education system is underfunded. Children are not healthy. Our own Commissioner of Children and Youth has shown that.
But I think we're getting off the bill. Let's stick to the bill and the question that was asked, and let's stay to the bill.
So to continue to answer your question of why this bill is so important is because Tennessee has not created a state where children are safe and healthy. So it's important that we reinstate this healthcare access because women need options, because we are not doing a good job of taking care of the children that's already here. And so women need to have this option if they're having a medical emergency, if they are victims of rape, if they are victims of incest. And it's disgusting if we make children who are victims of rape carry a baby to term. But that's the state that we're creating.
Okay. Senator Lamar, we're going to have to move on. I think Clemens, you have a question?
Absolutely. Thank you, Madam Chair. Senator Lamar, thank you for being here with us today. You know, I lost you a couple of years ago in the House, but I guess our loss was the Senate's gain, though I do miss you. And I was hoping you'd bring your son with you today. I'll go find him. You know, if you could elaborate, I know this legislation tackles this from many options, and access to care should be the rule and not the exception in states like ours. And you had mentioned just briefly the impact of your health issues with your first pregnancy. Can you give us a little example of the emotional toll and kind of what this legislation means to you from a personal perspective?
Absolutely. That's a great question. So I don't know I know there's a lot of women who I speak for when I say it was no fun to bury a child, to have to pay for a funeral, to almost lose my life, to see my mother in that room crying because the doctor said, if I don't put you out, you may die on this operating table. That's my story. And luckily in this next pregnancy I had, my son made it. But I had to undergo very extreme medical treatments in order to see this pregnancy to full term. My cousin died from preeclampsia of pregnancy, and a doctor told her at the beginning of pregnancy, if you carry this baby to full term and don't have an abortion, you're going to die. And she did die, and so did that baby. I had another cousin who just lost her baby to preeclampsia 2 weeks ago. Women, especially Black women, have a hard time when it comes to pregnancy because of the state of Tennessee and the state of our healthcare here. And until you have to bury children, I think it's unfair to say we're going to ban abortion and make women like me risk their life in order to carry a baby that they know is not healthy for them. So I don't think banning abortion saves anybody's lives. What I've seen is not having abortions go put not only the baby in that grave, but the woman too. Again, banning abortion does not work. It does not save lives. And that is why we need to pass this bill to give women who could experience a medical emergency options to prevent victims of rape from having to carry a rapist baby to term. That is why I'm co-sponsoring this bill, because it's the right thing to do.
Are there any more questions for our guest? Okay, seeing none, we will go back into session. No, well, yeah. Yeah, he's still going to. Okay, we're going back out of session because we have Dr. Henry Williams. There you are. Please come and state your name and who you're with, and make sure your red light is on, and you'll have 2 minutes. Thank you. So is the red button on with your mic?
Oh, yeah. Now, can you hear me?
Yeah, thank you.
I'm an internal medicine physician from Chattanooga, and this is a terribly difficult issue that we discuss here. I sympathize tremendously with women in crisis pregnancies. I need to speak in opposition to the bill because of convictions that I have, and as a member of the Christian Medical and Dental Associations, which is the largest faith-based organization of health professionals in the United States, 19,000 members. Their position on abortion is that life begins at conception and the fetus has rights and status consistent with historic Hippocratic and Judeo-Christian tradition. This bill, 1626, has many deletions of present law with an extreme statements about the fetus, no sort of respect for the fetus. The first paragraph says, everyone has a fundamental right to make decisions regarding reproductive health care. It then states that an embryo or fetus does not have any independent rights. These are starkly contrasting statements, even a contradiction. If there's any inkling that what is forming in a woman's womb over a 9-month period might be a developing person. The bill would also prohibit any interference by the state. I think the state may well have legitimate interest in applying some kind of safeguards, for example, in the area of informed consent. There's a need, as a study has shown, that 67% of women said they received no counseling prior to abortion, and only 11% felt their counseling was adequate. The bill also contains confusing language, I think, about parental consent for minors, but I won't go into detail there. In Chattanooga, there's a place called the National Memorial for the Unborn. This place features a 50-foot granite wall with thousands of brass nameplates displaying the names of babies that have been lost to abortion. Women and family members have come from the U.S. and several distant nations to place a plaque and obtain closure.
I'm sorry,
on the pain
Dr. Williams, you're
of what
out
they
of,
have lost.
out of time, but please stay there in case any of our members have any questions for our guest. Okay, Representative Clemens.
Thank you, Madam Chair. I'm curious, and you're an internal medicine doctor, you're not an OBGYN, is that correct? Okay. So why should we not trust women in consultation with a qualified specialist, healthcare provider, their doctor, their family, their faith, to make the best decision for themselves and their future?
We should respect their decisions, their pleas, but we should also, because we have to respect the other person that's not yet born, who, you may want to divide it up and decide when life begins, but personhood certainly begins before birth, and there's a person involved. Two people.
Do you have opinion as to at what point?
Well, life begins at conception. I think there's room for debate about how the law needs to deal with that.
Thank you.
Any more questions for our guest? Okay, seeing none, we will go back in session. And Representative Bain, do you have?
Yeah, just quickly, first of all, Chair Lady Carringer, I just want to say thank you for allowing me to present. But this piece of legislation is not for you all. It's for the tens of thousands of Tennesseans who disagree with what's happening right now and are standing up for reproductive access and for a state that resoundingly believes in that. So thank you.
Does anyone have any questions for a sponsor? Okay, seeing none, thank you. So there's been a question on the bill. All those in favor say aye.
Aye.
All those opposed?
No.
The noes have it. Okay, we will be moving on to the next bill. I'm going to turn my pages here. It's going to be item 3, House Bill 1943 by Representative Johnson. Yeah. You're ready to go, Representative Johnson.
Thank you, Madam Chair, and I'd like to request a roll call vote.
Okay.
Thank you. House Bill 1943 is an important bill that would guarantee the right for all Tennesseans to use or refuse the contraceptive method of their choosing and ensure access to those contraceptive methods. 90% of Americans support contraception access. A majority of Tennesseans support contraception access. But in the Dobbs decision, the Supreme Court rejected the idea that all Americans have a right to reproductive privacy. Instead, the court ruled our freedom to make decisions about if, when, and how we start or expand our family is up to the state. As Tennesseans, our freedom to birth control is already under threat. We know it because we heard the leaked audio tape where extreme interest groups are speaking with Tennessee lawmakers about their plan to restrict fertility care and birth control in the next few years. The majority of women ages 18 to 64, 90% have used contraception at some point in their reproductive years, and 76 have used more than one contraceptive method throughout their lifetime. 40% of contraception users use contraception to treat a medical condition. And still, it's estimated that more than 400,000 women in Tennessee who are already struggling to make ends meet live in contraceptive deserts where they face untenable costs for transportation, childcare, and taking unpaid time off work just to access basic health care. It's crucial that we protect the freedom of all Tennesseans to access the contraceptive method of their choice. Research shows that early and legal access to contraception significantly reduces poverty and increases educational opportunities among women and their families. It is crucial that we codify Tennesseans' freedom to prevent pregnancy, treat other medical conditions, and ease premenstrual and menstrual symptoms. Thank you all for allowing me to introduce this for your consideration today. And I believe we have some guests who would like to speak on the topic.
Thank you, Representative Johnson. Yes, we have two that have come and asked to speak. First one is Amy Gordon Bono and Bailey Jones. Are you both here today? Okay, please come to the front and y'all can decide who wants to go first. And just state your name and who you're with and make sure your red light is on, and you each will have 2 minutes. I can't remember if I ran the gavel, so we are out of session.
Thank you so much for giving me the opportunity to speak here today. I'm Dr. Amy Gordon Bono, a native Tennessean originally from Pulaski, board certified in internal medicine, and I've been practicing medicine in Tennessee for almost 13 years. I'm a primary care physician in Wilson County and a member of the National Academy of Medicine and the Tennessee Medical Association. I'm speaking today as a concerned physician and not on behalf of any institution, organization, or employer. I urge you to support House Bill 1943, the Tennessee Contraceptive Freedom Act. This bill supports the freedom of patients to access contraceptive health care and protects healthcare providers as we provide that much-needed health care. Patients are worried about their reproductive health. Patients fear that access to pregnancy prevention methods will become harder. As a physician, seeing this concern among my patients, I ask this legislative body take steps to please help my patients and pass this bill. Contraception is a basic right that allows individuals to take control of their own lives and make choices about their reproductive health. The freedom to decide whether or when to have a child has implications for an individual's financial well-being, job security, workforce participation, and educational goals. With this bill, we can make sure that all Tennesseans have the support and legal ability to make decisions that are best for themselves and their families. The majority of women ages 18 to 64, at least 90% of them, have used contraception at some point in their reproductive years, and many have used more than one contraceptive method throughout their lifetime. These numbers clearly indicate women and families need access to contraceptive care. As a physician, every day I see how access to contraception can change lives for the better. Birth control is safe and essential health care, and access to contraceptive care is necessary for the prevention of unintended pregnancy and protection from sexually transmitted disease. Contraception benefits an individual, and contraception helps us all. Passing this legislation, which expands access to and funding for birth control, is smart public health policy. Studies from some states demonstrate that public funding for birth control substantially reduces government health costs mostly by reducing public spending on unintended pregnancies and bringing people out of poverty.
Okay, you're out of time.
Thank
So
you.
we'll go on to our next guest. Thank you very much. Just state your name and who you're with and make sure the red button is on. You'll have 2 minutes.
Okay, can y'all hear me? Okay, how about now? Okay, my name is Bailey Jones. I'm here on behalf of all people across Tennessee. I'm speaking here today as a concerned citizen, as a mother, and as a sexual assault survivor. And I'm urging you to support House Bill 1943. This bill ensures all Tennesseans have the freedom to control our bodies, lives, and futures. It's vital to us all. I'm grateful to be here in front of you today to tell you my experience with birth control. I have 2 sons. My oldest is 7, he's in the 1st grade, and my youngest is 2. They're handsome, they're smart, they're caring, they're kind, and they were so wanted when I was blessed with the choice to become a mother. I was so glad to have that choice. But now I want to tell you something a bit darker, very personal, and possibly upsetting. This is very vulnerable, and I ask for you to hold space for that. 2 years after the birth of my first son, I was violently raped 2 miles from where we sit today by a man who was and is still a stranger, aside from being in my nightmares. He took advantage of me, a naive young lady at the time, which I am no longer. He almost murdered me, trying to keep me quiet. That was almost 6 years ago. Throughout the process of being in the hospital, having an intrusive rape kit done, talking to the police, one question kept coming up and lingering in my mind: could you be pregnant? It was the question of the hour. Not, are you okay? Do you need a hug? Or how dare he? Could you be pregnant? I thank God every day that the answer was no. I was not pregnant, and I was 99% sure due to my Mirena IUD inserted 6 weeks after my first son. That little piece of metal allowed me the choice to take my reproductive health into my own hands. I'm asking you to genuinely consider the struggles and challenges that the women and girls of our state go through, as I am not alone.
Okay, you're out of time. Thank you very much. Before we go back in session, are any questions for our guest here today? Representative Clemens?
Yeah, I just wanted to ask you if you had anything additional to say.
I just ask that you think of your daughters and your granddaughters and the women that you love, and think of them in my position, because this could happen to any of your loved ones as well. And I would hope that you want to ensure that they have the right to protect themselves from a pregnancy that could cause them great trauma. Thank you.
Thank you,
Any
thank you,
more
Madam Chair.
questions?
Thank you for your courage. Thank you for representing and speaking out on behalf of your patients.
Are there any more questions? And I also wanted to say thank you for coming and sharing your thoughts and with us today and taking the time. So thank you very much. We will be going back into session. And with that, does anyone have any questions for our sponsor? Representative Clemens.
Thank you, Madam Chair. I was listening to that testimony, both of the women who spoke here today. The statistic that the majority of females 18 to 64, around 90%, have used contraception at some point in their reproductive years is pretty staggering. I mean, something that 90% of women take advantage of seems like something worth protecting to me.
Absolutely. This idea that we don't trust women is pretty sad, knowing that women do absolutely everything they can to make sure they can choose when to start that family. But, sometimes it doesn't work 100%, and sometimes it's not their choice. And so it is so critical that we protect this. And we know we have to protect it because we have heard the audio of folks that are coming after birth control and IVF.
Thank you, Madam Chair. And additionally, something that I hadn't even considered before really listening to the testimony today is the use of contraceptives to manage medical conditions and prevent the spread of sexually transmitted infections. And here in Tennessee, we unfortunately have laws on the books, archaic laws that criminalize some of that, and so it's important to prevent the spread of those.
Sorry, it's hugely important. I know many of my friends' children who have had to use contraceptives for various medical problems. It is not unusual, and so it is critical that we keep this in place, and then we pass this legislation that makes sure that it's always available, and for people to use, or as I said, to refuse if they choose.
Thank you, Madam Chair. I'm astounded. I never thought we would be in the situation that we're in today, to be honest with you. Personally, my wife strongly agrees with me on this. And so to think that we even have to pass a law to protect contraception is a bit shocking to me. I thank you for bringing this legislation. I would hope that my colleagues would join us in this. Again, this is a very straightforward piece of legislation protecting a right I think Americans and Tennesseans rightfully take it for granted.
Yes.
It just seems like one of those basic things that we shouldn't even have to be up here. And the fact that people are talking about limiting access and that courts have opened the door to limiting access is very concerning. It should scare the heck out of every one of us. So thank you for this piece of legislation.
Thank you. Absolutely. And it does scare women. I mean, it is really terrifying to think that you can't, make a family plan with your family and your physician and take whichever method works the best for you. And all that this does is enshrine that ability into our code.
Representative Hemmer, you recognize.
Thank you, Madam Chair. Thank you, sponsor, for bringing this very important piece of legislation. Saw even on the news today that first over-the-counter birth control was going on sale across the United States. Seen polls showed 90% of Americans support birth control and access contraception. But based on the Dobbs decision last year, that could be in question. So I would wonder, from your perspective and bring this bill, why this is so essential to putting in this in state statute to give these women, the protections that my colleague next to me said that are sometimes taken for granted until that right's lost. But could you speak to that, please?
Yeah, absolutely. You're right. The Dobbs decision, the way it was worded, does allow for them to come back and change how that works in our states. So it allows the states to do something. And as we have heard in audio tape, there are groups that want to end contraception and that also want to end IVF. So it is critical that we have this basic health care for women available, and not just for women, for families. And we're continually developing new methods for contraceptives. And I think that everything that prevents a pregnancy should be available in order for women to choose the best contraceptive for them and for their body and for their family.
Okay, are there any more questions for our sponsor? Chairman Terry.
Thank you, Chairman, and to the sponsor. And as we debated this in the other on the other bill, this is already something that's not it's protected. We're not, the other law does not go after this. There are a litany of attorneys that are out there that Vanderbilt has, and they're handing out Plan B on there. The law that we have on the books, can be protected, and that's adding ambiguity into this, like other health needs and stuff like that, makes it harder for us to defend that law and protect the unborn. Last night, my concern with this bill is one in which we are catering to folks who are uninformed or not informed that this doesn't even exist yet. So when we write a bill to stop it, it makes people think that this is a thing that's happening and they get concerned. And so the reality is what we should do is educate our districts. You said that.
Yes, I
Yeah.
did.
And so this is not a threat. What we have is IVF, which is the other bill, and contraceptive. Nobody's going after them. It's already protected. And so with this bill, I think you add ambiguity and it's going to impede our other laws. And so I'll be voting no.
There is no ambiguity in this bill. And just maybe a week ago, this body passed a bill to outlaw vaccines on lettuce and tomatoes.
Let's stay on the bill.
This goes to his argument, ma'am. Madam Chair, this goes to his argument. I'm discussing the argument on my bill, and the argument is it's not necessary. We have tapes of people with Tennessee House representatives saying they are coming after birth control and IVF, but we passed a bill that we won't have vegetables with vaccines, though we have passed no bill for vegetables with vaccines, because vegetables with vaccines are not a thing at this point. It's experimentation. We know this is something was coming. We've heard tape of it.
Okay. Chairman Kumar?
Thank you, Madam Chair. Just a yes or no, it's really possible sometimes to say that. Are contraceptives widely and freely available today?
In some areas, no. I think I addressed that at the beginning, and there are contraceptive deserts in places. And go ahead, I'm sorry. Did you?
I mean, they're deserts because of the cost, or they're just not
or access to OBGYN care.
You don't have to have an OBGYN for vaccination. But it's late in the afternoon for contraception. And I really think that what you're implying here are very unbelievable ideas, such as your discussion that contraceptions prevent STDs. There is no medical reason to believe that. I think you're justifying your point of view for something that is widely available. There's no threat to it. And it's, again, with the new law, it's going to be available even over the counter. And giving people an impression that this right of theirs is in jeopardy, it's really unfair. It's really unfair. Thank you, Madam Chair.
Thank you, Chairman. And quickly.
I guess, Chairman, or I guess, Representative, so you're saying that the tape doesn't exist where Tennessee House reps and Right to Life folks are talking about going after contraceptive care and IVF? Because I can pull it up for you.
No, I mean, there are tapes out there on the internet of all kinds, but on a serious level, in the legislature, that really is not a consideration. And if it ever becomes, I'll vote with you.
Well, why don't we just go ahead? If you're saying that it's already there and it's not a concern, why don't we just vote for it?
I didn't say that it's already there, already exists. I think this is being, again, in the interest of time, I don't think we're getting anywhere. Yeah. But this is something that is widely available and really being used, and nobody is trying to ban it. So I don't know, saying that keep it widely available would do anything and would not change anything, sincerely. And thank you, Madam Chair.
Thank you, Chairman. Chairman Farmer?
Thank you, Mr. Question on the bill.
Okay.
Thank you.
So we have a question on the bill, and so therefore we will be doing a roll call.
Yeah.
Yeah, she asked for a roll call.
You can object.
Yeah, so we're voting on the objection to not have on the previous question.
What?
I objected to the previous question, so we're voting on that, I believe. Right, Madam Chair?
To the previous question, so we're voting on the motion.
For previous question.
Yes. So we'll call the roll.
Clemens,
No.
Farmer. Yes. Himmer. No. Kumar.
Yes.
Rudder.
Yes.
Terry.
Yes.
Madam Chairman.
Yes. So the yes have it. So we are going to be doing the roll call now on House Bill 1943. So Clerk, will you call the roll on House Bill 1943, please?
Clemens,
Yes.
Farmer.
No.
Himmer.
Aye.
Kumar. Kumar.
We're voting on the bill now. Yes, yes.
No.
Rudder.
No.
Terry.
No.
Chairman.
No. So,
2 ayes. 5 noes.
okay. So the bill fails due to receive a majority. So,
Thank you, Madam Chair and committee.
Thank you. So that ends our agenda for the day. However, this is our last meeting, and I just want to thank all of the members, and Population Health Subcommittee is closed subject to the call of the chair. Oh, sorry. Did